presence of ovarian cysts is the only requirement for the diagnosis of PCOS. Contrary to popular belief, ovarian cysts are not the only sole criterion for diagnosis of PCOS. The diagnosis is based on at least two of the following: irregular menstrual cycles, signs of high androgen levels, and polycystic ovaries on ultrasound. Some women with PCOS may not even have visible cysts.
A myth that surrounds PCOS is having an irregular menstrual cycle, but I'm here to tell you that's not necessarily true. Irregular cycles can result from various other factors such as stress, significant weight changes, thyroid disorders, or other hormonal imbalances. While irregular periods are a common symptom of PCOS, a diagnosis requires meeting additional criteria such as elevated androgen levels or the presence of polycystic ovaries in an ultrasound. Misattributing irregular cycles solely to PCOS can lead to overdiagnosis or overlook other underlying health conditions, so it's best to seek advice from your physician.
Another myth would be that in PCOS you cannot get pregnant or it causes you to be infertile. However, this is not true. With PCOS, it is still possible to get pregnant. PCOS can also cause infertility, however, it is very treatable during the medicine these days. Hormonal imbalance interferes with the growth and egg release from the ovary, which is in ovulation. If ovulation does not occur, then you cannot get pregnant.
Another myth is that PCOS causes weight gain or prevents weight loss. But the fact is, the relationship between PCOS and weight remains unclear. Studies have shown that women with and without PCOS who are undergoing weight management interventions such as diet and behavior change programs have found to lose the same amount of weight. Yet, it is still highly encouraged to optimize a healthy lifestyle because even with small amount of weight change or weight loss, PCOS can still be improved.
Myth: PCOS goes away during menopause. Fact: during different stages of life, the PCOS phenotype can change. The syndrome evolves from being a reproductive disease to a more metabolic disorder with increasing age. Along with metabolic disorders like insulin resistance, PCOS is also a major risk factor for the development of type 2 diabetes and cardiovascular disease in later life. This is why PCOS requires a personalized diagnostic approach and treatment.
Myth: birth pills can cure PCOS. Fact is that there is actually no definitive cure for PCOS, rather that these contraceptive pills or birth pills are used to alleviate the signs and symptoms of PCOS. For instance, it helps in regulating the menstrual cycle of a woman, or it even helps in reducing the levels of androgens in the body.
PCOS is reversible. This is a myth. Unfortunately, PCOS cannot be cured. However, it can be managed over time. Some ways of managing PCOS is through dietary changes, such as limiting the consumption of added sugars and fatty foods, and instead consuming more fresh fruits and vegetables. Lifestyle changes, such as moderate to vigorous physical activity for at least 60 minutes a week, is also recommended.